conditions, drug of choice is Gomutra Haritaki. If you utilize Gomutra Haritaki with the Arogyavardhini, such patients respond wonderfully. And Nitya Virechana can be given with the Eranda Taila with the Gomutra Haritaki. I think this should be line of treatment. And if it is Shula is there, give Shula Hara Chikitsa like Hingvastaka, Narikela.
Okay, sir.
Okay.
Inderjeet, if you want to ask sir something, you may do so.
Yeah. Good evening, sir.
Yes, good evening.
So the same patient has complaint of bleeding piles intermittently,
Uh,
and he has a ultrasound with 17 centimeter of liver and moderate hepatomegaly, sir.
yeah.
I think, sir, he has not cirrhosis, but it is moderate hepatomegaly.
Okay, okay.
Yes,
No,
sir.
yeah, I got it. If I say bleeding piles is there, the piles should be treated. Otherwise, patient may went up with severe anemia. It can be treated with the Ksharakharma or ligation by rubber banding. Both can be done. After that, you should give treatment for this one. Nitya Virechana you give with the Gomutra Haritaki. Definitely, patient will respond. Uh, that should be a line of treatment. First, I think that bleeding should be stopped. Otherwise, by Nitya Virechana, there will be bleeding daily.
Okay, sir.
2-3 motion, every time there will be bleeding.
Okay, sir.
First, tackle with that hemorrhoid condition. Then,
Okay, sir.
Nitya Virechana. Patient will respond in such cases.
Thank you, sir.
Yes.
Thank you, sir. Now we have the next question. Sir, vitamin D and vitamin B12 deficiency. How to treat this using Ayurvedic kalpas?
Vitamin
Vitamin D and B12.
D and B12.
Yes, sir.
I think we should not think according to that by Ayurveda treatment. You give Satyavamana Satyavirechana and give Agnimandhyahara Chikitsa, then give specific drugs like Gritas and specifically I think Shatpala Grita and Mahatikta Grita or Kalyana Gritas. They will respond very nicely. But if pernicious anemia is there due to then the B12 deficiency, he may be needed injections. We can't treat. But otherwise, all these conditions can be treated, specifically with the Gritas.
Okay.
Dudhutikta Grita or Mahatikta Grita. If you utilize it, vitamin D deficiency can be tackled.
Okay. Yeah. Sir, this was asked by Dr. Ujjwala. Ujjwala, do you want to ask anything specifically regarding this question? You may do so. I hope she's fine with the answer. So we'll go on to the next question, sir, from Dr. Sairam. In follow-up, should the medicine be changed as per dosha changes after few days, or give Vyadhi Viparita Chikitsa for few months like in Amla Pitta?
Amla Pitta also not only Vyadhi, in Amla Pitta also Vataja, Pittaja, Kaphaja presentation will be there. And any Vyadhis, according to stage there will be change in doshas. So that is why in IPD daily we are doing the rounds morning and evening. If any change in dosha presentation, we will change the drug. In the OPD level, that is why patient comes once in a week or once in 15 days on a chronic patients or daily in acute state. Whenever there is a symptoms changes, that means there will be change in the presentation of the dosha. Accordingly, drug should be changed. So in Amla Pitta also, don't think the patient may come with the severe Pitta Pradhana, Urdhvaga Amla Pitta or Adhoga Amla Pitta or maybe Vata Pradhana or Pitta Pradhana or Kapha Pradhana. In Kapha Pradhana there will be heaviness will be there. In a Pitta Pradhana, severe burning. Vata Pradhana there will be severe pain maybe there. So drugs will be changed. You can give Sutta Shekara, you can give Agni Tutti, you can give Kamadud Mukta. or you can give Vaishwana Churna or Hingvashtaka Churna or Avipattikara Churna. According to presentation, drug should be changed. In Ayurveda, he never, Sushruta or Charaka never tells you should give same drug continuous for 1 month. Same drug you give as a Kala Basti or Karma Basti, same Basti you give, not like that. That is why you are seeing the patient daily, morning and evening. Or once in a chronic patient, OPD, once in a week, why a patient comes there, you can write today itself a drug you take for 3 months. It is not possible like that. According to presentation, which dosha involved, like that you have to change. Then that is why Charaka says avastha vashena chikitsam kuryat. Desha kala bala avastha. That should be decided by swayam dhiya uhya. Each physician with its intelligence, he has to do uhana. That is a creativity of the individual physician. Even though 15 students learn in the same class, each Vaidya will be different according to his own uhana. Some person will excel in their practice, some person may not excel at all. So who have that creativity, they will excel in their practice. That is the beauty of Ayurveda. Medical practice beauty itself is like that. Okay,
Thanks, sir.
I think I have answered your question.
Yes, sir. Sir, also can I ask you about the Apunarbhava Chikitsa of Pittaja Agnimandya?
Pardon?
Apunarbhava Chikitsa of Pittaja Agnimandya.
Apunarbhava?
Chikitsa of Pittaja Agnimandya. Any kalpas that you would like to give in Pittaja Agnimandya condition?
In any condition you see which dosha involved, like that you have to treat. In the Pittaja Agniman, there will be severe burning sensation will be there. In such conditions, I think the Udumbara Kashaya, Kshira Kashaya works wonderfully in such conditions. I have seen many patients. And another thing is, if it is in a Pittaja condition, if Vata Samsarga is there, you give Shatavari Grita. That is wonderful. If it is a Kapha Samsarga, give Mahatiktaka Grita. Like that, you change and give the Gritas. Gritas are drug of choice in such conditions. That will work wonderful. Yeah.
Okay. Thank you, sir. Next question from Rupa Raval. Non-alcoholic fatty liver with pain and hepatomegaly. What should be the line of treatment?
Any liver condition, treatment should be given according to Yakrudodara.
Yes.
Maybe alcoholic or non-alcoholic.
Okay.
The drug of choice is Gomutra Haritaki
Okay.
and Nitya Virechana. And the fair number of cases you get good result. I don't think every case you can cure. And but there may be presentation differ. Some person may end up with Jalodhara, some person may end up with Kamala may be there, associated symptoms. Like that, you should give the specific treatment. So you can't say same treatment for everybody. Some person has already one case here told there will be severe bleeding for rectum. There may be esophageal varices bleeding may be there. So many complications are there. All these things you utilize and give the specific treatment. If you give Gomutra Haritaki, when there is a severe bleeding is there, bleeding will increase.
Right, right.
So after tackling that only you can give these drugs. Otherwise, by giving Gomutra Haritaki itself, there will be severe bleeding. So we should each case individual patient's presentation like that analyze and should be given. So I think I have answered your question.
Yes, sir. So next question, what treatment can be planned for tongue fissure with discoloration? Tongue fissure with discoloration. What treatment?
It is a Vata Pitta condition. Yashti Madhu and Amalaki Churna with Grita, if you utilize such conditions, will be cured. And Kamadu with Mukta can be utilized along with that. Such it should be mixed with the Grita and given to the patient. Specifically in Vata Pitta conditions, always Shatavari Grita is the drug of choice.
Okay.
Patient gets the relief. Yeah.
Okay, sir.
And another thing, these conditions, Mukharoga, You can give him Narikela Taila for gargling daily, once or twice. Such conditions will recover very fast.
Okay.
Yeah.
Sir, what will be the treatment protocol that can be planned in case of irritable bowel syndrome?
Irritable bowel syndrome. Very nice. Very good question. I think I have not tackled this condition. Usually, it is a Vataja condition. Vataja, it comes with Vataja Atisara. And also, another one is Bhaya Atisara and Shoka Atisara. This comes with irritable bowel syndrome. The drug of choice I usually utilize is one is Manasa Mitravati, Ekanga Virarasa, and Yashtimadu plain Kashaya give along with the Musta. Yashtimadu Musta plain Kashaya along with the Ekanga Virarasa and Manasa Mitravati. Such patients respond very well. In all the most of the patients respond very fast. You can utilize it. But according to other involvement of doshas, you may have to change. If Vajrana is there, you can give Agnidundi or Dadimastaka Churna or some other drugs may be needed in initial state. Once it is that Ajirana status gone, then you start give these drugs. Yashtimadu Musta Kashaya and Ekanga Veera Rasa and Manasantravati. Such patients respond very fast. Can be done. Yeah.
Okay, sir. Sir, next question. Treatment for Crohn's disease.
I think I have already told Crohn's and ulcerative colitis. It's autoimmune conditions. Yashtimadu Musta plain kashaya milk. Patient should not drink milk and Shankhavati. These two drugs are sufficient in most of the patients. And some other drugs associated symptoms like that utilize Dadimastaka or Parpati Kalpas, specifically Kutaja Parpati or Swarna Parpati or Vijaya Parpati. These things can be utilized. Whenever autoimmune conditions there, Swarna Basma included drugs works wonderfully. These things can be utilized. Yeah.
Sir, can you please suggest the treatment protocol for diverticulitis?
Diverticulitis, anyhow, how they present like that, it is there. If there is a perforation or these things, you should go for surgery. But otherwise, the treatment should be given according to presentation. If a Shula presentation is there or Ajirana presentation is there, treat according. I don't think it's a diverticulitis there is a specific drug is not there. According to presentation, drug of choice is Agnitundivati. Agnitundivati works wonderfully in such conditions. Even in appendicitis also, a patient comes with appendicitis, chronic recurrent appendicitis, just to give Agnitundivati continuously, they respond very nicely. And you can use Raktamokshana also by Jalavakavacharana. Fair amount of appendicitis reduces because Raktavarana Mata is there. When the Raktamokshana is immediately pain and these things symptoms will reduce. And Agnitundivati is the drug of choice in these conditions. Yeah.
Sir, place for Raktamokshana, sir? The area.
Area, it's a Gambhira Jalavaka. That is a Jalavaka should be utilized. In that Hasta Matra area of the Rakta is removed. And that right iliac region only you have to put the Jalavaka.
Okay.
That's what.
That's seriously, that's a new information, sir. That's why I just.
Yeah, definitely you can utilize it. In initial state of immediately patient gets relief.
Okay.
I don't say it is a parallel to surgery, but if the perforation is there, obstructive appendicitis is there, definitely you should go for surgery. But it is not obstructive appendicitis, definitely it will reduce. It can be tried in a if it's a remote place, there is no surgery, surgeon is not available. In such a condition, if you put the Jalavaka, patient gets very fast relief from his pain. If it is a non-obstructive worry, if it is obstructive, definitely you should go for surgery. Otherwise, there is a perforation or a gangrenous change may happen. So, anyhow, it is one possibility is there. I think all the physicians can have in their mind. Yeah.
Right, sir. Sir, treatment protocol for recurrent stomatitis.
stomatitis.
You have
So already I have told you all Mukharogas. Same Amalaki Yashtimadu Churna, Suchekara. If it is due to Agnimandya Hara Chikitsa should be given. And, don't think only Vata Pitta is there. Kapha Pitta may be there or Agnimandya may be there. That should be treated accordingly. Then only you get result by stomatitis. Yeah.
Sir, another question. I think, can you please give a brief account about the Grahani Chikitsa? All these are part of Grahani Chikitsa.
I have told you once.
Yes, you have already described about this, but I don't know whether she.
You see, in most of the Grahanis, usually what I see in many of the Ayurvedic physicians misdiagnose the case of Crohn's disease or ulcerative colitis as Grahani. Instead of comparing a modern disease into Ayurveda, you take Grahani as itself. How the patient comes with these symptoms of Muhurbadda Muhurdrava is there for any patient. Continuously there is a Muhurbadda Muhurdrava with all symptoms of Amlapitta or Agnimandya and heaviness, Udavarta. These symptoms will be there. These are independent disease also. These are all symptoms of Grahani. One is independent disease, another is these are all Amlapitta, Udavarta, Gulma, and these things are symptom of Grahani. Like that also they present you. So just to diagnose the Grahani. What is Atma Lakshana of Grahani? There will be Muhurbadda and Muhurdrava is there with these symptoms. Then diagnose it accordingly. But Krita is the drug of choice. First, what I do, whatever patient comes to me, I suggest them to undergo a Sadhyomana and Sadhyo Virecha. It can be done in OPD. Just to give Estibadu Phanta, just about 3-4 glasses. After taking 2-3 glasses of hot water, just to give him Estibadu Phanta. If there is a dosha uklesha, he will vomit out immediately in front of him. Once its vomiting is over, then give him a slight kanji, all these things. Next day, give him Eranda Thaila with Gomutra for Virechan, Sadhya Virechan. He will pass 2-3-4 stools, loose motions. Then once his Kosha Shuddhi occurs, there will be Agni Mandya Gon, Agni Deepti occurs. When Agni Deepti occurs, start him Grutas, specifically Changerya Gruta or Shatpala Gruta. Patient will recover, most of the patients will recover. As a Rasavashadi, Agni-Dhundi, Suchekara or Aragyavardhini, accordingly, if it's a Kapha Pradhana Aragyavardhini, if it's Vata Pradhana Agni-Dhundi, if it's Pitta Pradhana Sutrashekara Rasa. Just you give, such patients will recover very fast. I think I have given you
Yes, sir.
the treatment for.
Yes,
Yeah.
very beautiful explanation in the capsule form. Thank you, sir. Sir, what can be the drug of choice to increase the intestinal absorption?
Eh?
What will be the drug of choice to increase the intestinal absorption?
Absorption.
Yes.
I think Agni-Dhundi is the best drug.
Okay.
Agni-Dhundi, yeah.
Okay. Sir, medicine for Chaddi in pregnancy.
I think Mayura Picha Basma and Kamaduda with Mukta.
Okay.
These two things can be utilized in pregnancy.
Okay.
And Madi Palarasayam syrup. Three things can be utilized.
Sir, Arsha's treatment.
Arsha, I think next week there is a treatment for Purusha Srotas. I have told you already.
Okay.
I will discuss all Purusha Srotas Vyadis next week.
Right, sir, right.
Yeah.
Sir, Ayurvedic treatment for hepatitis B.
Hepatitis B, hepatitis A, B, C, D, E, F, anything comes under Kamala Chikitsa.
Okay.
There is no specific for hepatitis B, like that, not there. Give Kamala Chikitsa, you get relief. In acute stage patient presents, you can make it HBsAg negative by Ayurveda treatment. But it is a non-inflammatory state. It's a dormant state. It is very difficult. I don't think we can cure it. Yeah.
Okay, sir. Sir, is there any kalpanas to prevent appendicitis?
appendicitis to prevent.
Yes.
How you can give continuously for a normal person?
Like, sir, if a patient comes with a pain in the mass, in the
Yeah.
McBurney
So
point,
after coming, you have to treat it as how they present.
okay.
But how to prevent it? How for a healthy person can you give a drug like that continuously?
Right.
It is not possible. But I think their question may be for recurrent appendicitis. Once appendix happened, then it subsided. After 3-4 months, again recurrence occurs. For such cases, if you give Agnitundivati, there is no chance of recurrence afterwards.
Okay. Okay.
That can be done. Yeah.
Sir, in reflex esophagitis treatment,
It's Udavartahara Chikitsa.
Udavar.
I give Vaishwanara Churna is a drug of choice.
Okay.
Yeah.
Sir, treatment protocol for antral gastritis. Antral.
Okay. Any gastritis, you give Amlapittahara Chikitsa. There is nothing like this gas or that gas. According to anatomical specificity, there is no chikitsa. How they present you with dosha analysis and sthana analysis, you give the treatment. So already I have told Amlapitta.
Sir, patient having multiple aptoid ulcer in sigmoid colon, rectum. Please mention more Shamana Aushadhi apart from Musta and Yashti.
For what purpose?
Aptoid ulcer in sigmoid colon and rectum.
Sigmoid colon and
Rectum.
no, it is usually occurs due to ulcerative colitis or Crohn's diseases.
Okay.
I think ST Musta plain kashaya is the drug of choice. So, patient respond very nicely in such cases. If it is a case of malignancy, just you go for Arbuda Chikitsa, Shastra Kshara Agni Beshita. Like that you have to go. But patient presents with loose motion and Rakta, give ulcerative colitis Chikitsa. That should be done. Given. If it may be solitary ulcer syndrome may be there or multiple ulcer syndrome, so give same line of treatment. Or you can utilize Parpati kalpas. Parpati rasayanas can be given. One ratti, 1 day, second day, 2 ratti, third day, 3 ratti, 4 ratti, like 10 days you give, again a reduced dosage with takra as a takra anna as the patya bhojana. Many of these things can be cured. I don't say everyone will be cured because according to presentation, person to person that will differ. Like that, the result may differ. But definitely it gives wonderful result. You can utilize it in our practice. That's what. Yeah.
Okay, sir. Sir, some patients complaining of burning sensation and sore irritation, some complaining indigestion, and some patients having both the presentation. So, what should be the drug of choice in all these three conditions together?
When only severe burning, it is Vata Pitta condition. Give Sushekara and Kamadod Mukta. When indigestion, there will be heaviness, all these things. That's a Vata Kapha condition. Utilize Agnitundi and Vaishwanara Churna or Hingvashtaka Churna. Sometimes all three will be there. And Agnitundi, Sushekara, Kamadod Mukta and Vaishwanara Churna. All the drugs should be utilized according to percentage of the presentation. And Patya, patient should follow the Patya. That indigestion things with Amlavitta, that usually occurs due to Agnimandya and Ajirna is the cause. Whereas in the first these things there will be gastritis may be caused. So it is not the same area. The Sthana Samshaya area may differ. One is Pitta area and is Vata area. So like that drugs may be differ person to person. That's what you have to do.
Okay, sir.
Yeah.
Sir, in case of asymptomatic patient having slightly increased SGOT and SGPT, is treatment required or not?
Better to give, just to give Phalatrika Kashaya is sufficient. They respond very nicely.
Okay.
That may be Pura Rupa of any future disease like Kamala or this one, Yakrutodan.
Okay.
You see, sometimes patient presents with fatty liver without any symptom. By sonography, you will find out.
Okay.
That is actually with the help of modern diagnostic gadgets, we are finding out in Pura Rupa Avastha.
Okay.
Just give him Palatrika Kashaya or Arogyavardhini, these drugs, continuous for 1 or 2 months. They will respond very nicely. Can be cured. Yeah.
Okay. Okay, sir. Sir, how to clinically differentiate Amla Pitta and Vidagdha Ajirna?
I think in Amla Pitta also there will be Agnimadhya. In Vidagdha Ajirna also Agnimadhya. Drugs are same. There is no need to differentiate for academic purpose. As a, practically, we are treating both conditions are as a same. In a Pittaja, Amla Pitta or Vidagdha Ajirna. In Ajirna Avastha, you have to give Chikitsa for more of intestinal area. In Vidagdha, this one, Amla Pitta, there is more of gastric area treatment should be given. More of one is more Pittahara and one is more Vata Kapara Chikitsa should be given in Ajirna Avastha. So that slight differentiation is there. Just to utilize, should you use Avipattikara Churna or Hingvashtaka Churna? Should you use Vaishvanara Churna or Bhaskar Lavana? Like that, that's a differentiation. Lavanas are used more for this one Ajirnas, whereas this sugar is used for in more of Amla Pitta. Adhimatya. That difference is there, slight difference. That is why Swayam Duya Uhya. You have to do your own creativity. Do it treatment. I think here by sitting in a AC room, I can't tell this drug, that, like that. You can't compute it. In that particular situation, individual Vaidya should decide what should be given. These are all broad area. These protocols are given. It's just like mathematics. You see, in mathematics, there are theorems are there. We by heart all the theorems, but individual patients are individual problems. For each problem, you are utilizing one theorem and solving the problem. So patients are different problems, and utilize the theorems whatever learned in class. Utilize it and solve each problems. So you can't by heart these problems. You can't by heart. You can by heart the theorems. So utilize it and practice.
Right, sir.
Yeah. Yes.
Sir, another we have a case discussion. Dr. Pooja has written that she has a male patient with age of 18 years old, having complaints of abdominal pain, having stools after eating anything, depression, male pattern baldness is started, and recurrent stomatitis and loose motions. Patient is Karshia, history of gastritis. What should be the line of treatment?
I think patient is psychologically irritated, be irritable bowel syndrome. The treatment is Bhayatisara, Shokatisara Chikitsa should be done.
Okay.
Specifically, utilize Yashtimadu and Musta plain Kashaya and Manasamitra Vati and Shankavati. These things, if utilized, patient may respond very nicely. That can be done to the patient.
Okay.
That is sufficient. This patient may respond. Manasamitra Vati, Yashtimadu, Musta Kashaya and Shankavati. This may be sufficient. Such patient may respond very nicely.
Okay, sir.
Yeah.
Sir, treatment for tonsillitis condition.
Huh?
Tonsillitis.
Tonsillitis.
Yes.
Okay. For tonsillitis, is in the throat. Patient it is a runashotha. Occurs due to Raktavarna Vata Prakopa. Rakta Dushti may be by allergy condition or Ahara Vihara or by Krimi. So, as a Shamanavashadi, Gandhakrasan and Triphala Buggulu. If a presentation of Kasa is there, Thayasya Shunga, that churnas should be given with honey or Draksharishta. If presentation is pain, Gandhaka Rasayana Triphala Gukulu. If Jwara presentation is there, Mrutyunjaya Rasayana Amrita should be done. It's an acute state. When the patient goes into chronic recurrence, in the dormant state, you do Kshara Karma on tonsils. If a Shalakya person, Shadya person, they can do the Kshara Karma. If Pratisaranya Kshara, what I am saying, or as a Shamana Vishadi, Gandhaka Rasayana Triphala Gukulu, if you give continuously, and with the Mrutyunjaya Rasayana, the recurrent tonsillitis can be cured. But if you do Kshara Karma, there is no need of giving drugs afterwards. They will be cured. That can be done. Yeah.
Okay, sir. Sir, can you please tell us the medicine for worm infestation? Worm infestation.
Yeah. Worm infestation is the Malaja Krimi, the Krimi Kuthara Rasa and Admitundi. These two drugs are wonderful drugs. You can utilize with the Vidangarishta and Khadirarishta. These two drugs, Kashayas and Admitundi and Krimi Kuthara Rasa. Utilize it continuously for about 15 days to 1 month. The recurrent worm infestation can be cured. Most of the cases will be cured.
Management of hernia through Ayurveda. Hernia conditions through Ayurveda.
No, in the Ayurveda it is told to do the surgery. Shastra Chikitsa. And Ayurveda itself is told to do surgery. Antaruddhi. Yeah. But in initial stage, one interesting thing is, if a patient comes in initial stage, actually hernia is not formed. Patient comes with the pain in that area. Many a patient comes to with that condition. If already hernia happened, you should go for surgery.
Right.
If already hernia not happened, that's a pre-hernia state actually. Patient comes with severe pain in that area. Just you Yoga Raja Gugulu, on the patient will be cured.
Okay.
Yoga Raja Gugulu, that's sufficient. Even in a hernia state, a patient comes with the pain, just you give Yoga Raja Gugulu, they respond very nicely.
Okay.
Today you give Yoga Raja Gugulu, by 2 days you get result.
Okay.
It's a very good weapon in the hands of Ayurveda physicians.
Okay, sir.
But always hernia already happened, better to do the surgery, unless the patient may end up with some acute state of obstructive hernia.
Right.
Yeah. Okay.
Sir, can you please specify some patyas in Grahani?
For Grahani, yeah, Patya for all gastrointestinal tract diseases, Agni, Mandyahara, whatever Nidana is there, this should be fast food or whatever food now we are taking today, that should be avoided. You should go for ancient way of food preparation and food material should go. Avoid milk. Today's milk is Visha. So better to utilize takra always in your food. And avoid even curd, definitely it can be used, but if ajirna for curd is there, just buttermilk is the best drug as a patya for all the dishes. Freshly prepared buttermilk takra is the best drug as a patya. And drink plenty of water. That is specifically hot water. In the early morning, drinking water about 720 ml, 750 ml, as told in Yoga Ratnakara. Just getting up, you drink plenty of water. So many of the diseases of gastrointestinal tract can be cured. Specifically, this Agni Mandya, Ajirna, all these things, that Udavarta, these things, everything. Whatever due to this food habit, this can happen. Better to avoid all fast food, whatever we are drinking today, we are taking. After having a heavy food, at the end you take ice cream. Actually, Madura Ahara should be taken at first. Kashaya Rasa, Tarka should be taken at the end. Now, we ulta happened. Sweet and ice cream at the end we take. Desserts like that. So, these things if you avoid, go according, the food should be taken according to Ayurveda methodology. That's the best patya and apatya. Utilize it. Yeah.
Right, sir. Very right. Sir, for drug-induced hepatitis, any specific kalpanas? Drug-induced hepatitis.
Drug-induced hepatitis.
Yes.
I think Palatrika Kashaya is the drug of choice.
Okay.
Palatrika Kashaya.
Okay.
Or Patola Katurohinian. These drugs can be utilized.
Okay. Sir, we get a lot of cases with gallbladder polyp and gallbladder stone. So, can you please tell us the management for it?
I think I have already told, if patient it is a accidental finding of stone, no need of any drug. If patient having symptoms like pain, these things, Narikalavana is a drug of choice. If a patient is having infection, hepatitis, cholecystitis is there, better to go for surgery. Otherwise, patient may end up with some complications.
Okay.
If non-infective stage, then definitely you give Narikela Lavana with the Navasara Churna and Vaishwanara Churna. Patient gets relief very nicely. Yeah.
Okay.
Because that stone becomes silent. Stone becomes silent. Yeah.
Sir, can we give Shuta Shekara in constipation with Amla Pitta as it contains Billua?
Yeah, you can give Sudshekara, no problem.
Okay.
Give Anuloma Chikisa along with that. Sudshekara with Avipattikara Churna you give.
Okay.
So that is not a problem. You can give.
Sir, the same medicine can we give in the early stage of Grahani, Amaja Grahani?
Huh?
Can we give the same medicine like Shuta Shekara?
No, Sudshekara you can give. But Sagnimandi is the, instead of Avipattikara Churna, give Vaishwanara Churna.
Okay.
The difference. So that drug, these churnas I have mentioned all these things, that should be selected according to presentation.
Okay. Sir,
Dosha,
also,
Vyadhi Viparachikisa. For Vyadhi, if you take Sushekara, as a dosha, you have to utilize Vaishwana Churna or Avipattikara Churna or Hingvashtaka Churna like that. You see, interesting about Vaishwanara and Hingvashtaka is there is a condition, Ana and Atmana. And what is difference between Ana and Atmana? Both conditions there will be flat length. Then what is the difference? The difference is in Anaha there will be loose stool with the flat legs. In Admana there will be hard stool with the flat legs.
okay.
When Admana is there you use Vaishwanara Churna. When Anaha is there you use Hingvashtaka.
Okay.
That is the difference. So same condition but the wording is different
Okay.
according to presentation. So drug will differ.
Okay.
Yeah.
Sir, for splenomegaly, can we give something?
Actually it is a Raktosrota Vyadhi. Anyhow, same Yakrutodara Chikitsa should be adopted for Klihodara also. Anyhow, there is a limitation. Why it occurred, that comes into play. Why this splenomegaly occurred? Due to, is it malarial infection? Or is it a growth? Or is it this metabolic disorder? Why it happened? Is it due to cirrhosis of liver? So like that, that differs. If it is cirrhosis liver, it gives same Yakrutodara Chikitsa. If it reduces, that is also reduced. Otherwise, these things are Yapya and Asadhya Vyadhis. Yeah.
Sir, dry cough after taking food. How to think about dosha and treatment?
Eh?
Dry cough after taking food. How to think about the dosha and the treatment?
Definitely, it is an Vataja condition, dry cough.
Okay.
Vataja condition. Maybe allergic thing or maybe some irritation may happen. There may be any cause may happen. Just to give specific treatment, Vatahara Chikitsa you give, patient may respond. I think by saying taking a single symptom, I think it's very difficult without seeing the patient to explain what treatment should be given. I think that individual physician should think at that state and should give a specific treatment. Maybe Kasara Chikitsa or Agnimadya Chikitsa should be Given.
Okay. Sir, Dr. Ujjwala had asked this question. I think she wants to talk to you. Ujjwala,
Definitely, you can ask the question.
Hello. Hello, sir.
Ujjwala, can you speak a little bit? Your volume is very much
Hello.
reduced.
Hello.
Yes, yes, you can ask.
Hello, sir. Same. That patient is allergic. Always, he has a throat infection
Ah,
and always get dry cough.
yeah.
And mostly after food it increases. So I am confused. After food, that kapha dosha will increase. But why he is getting the dry cough? That I am confusing. And already I have started Sut Shekhar Ras and Avipatti Karchurna because it's allergic condition and it's like recurrent throat infection he has.
Yeah, definitely. Okay, I got it. You
And
give,
Yashti Madhu also I have added, sir. Suteshekar, Yashti Madhu, and Avi Pattikar I have added for that patient, but still it is not responding.
yeah, the chikitsa should be given of Kasa chikitsa. Thalisa Eshtishrunga with the Laghu Shekhar Rasa should be given.
Okay, okay, sir.
Laghu Shekhar Rasa should be
Okay,
given with the Thalisa Eshtishrunga because
okay,
irritation can be reduced by Yashti Madhu. Thalisa the Yashti Madhu and Shrunga Vastu. It's a Vata Kafahara chikitsa. You give Vata Kafahara chikitsa with the Draksharishta. Sushekara, if needed, you can give, no problem with that. And Laghu Sushekara Rasa, if you give, patient will respond. And tell them to take hot water gargling with salt.
okay, sir.
Yeah, patient will respond.
Sir, one more question I have. Sir, if patient gets not lose motion, irritation after eating outside food or sometimes home cooked food also, that is from like Sahaj, that Koshta is very mrudu. So can we consider as and if he get tension also like Bhaya
Yeah,
Jatisara you told.
yeah, definitely. You should consider as a Shokatisara, as irritable bowel syndrome. The same chikitsa you
As
give,
soon as
the
he eat the
patient will
food,
respond.
goes for the motion. And if he eats outside food, most of the time he gets the bacterial infection positive in that stool routine. So what? And if the patient is Vata Pitta, if I gave Sanjeevani Vati, but it didn't respond that time because
Uh, I think in this condition you have to give treatment for Ajirana, Krimi, and Bhayatisara. All these treatments. Dadi Mastaka Churana and Agnitundi you give with the Kutaja Varpati. Once he get relief from that, then start that Manasamitravati and Yashti Madhu Kashaya. So that can be done afterwards. First, you give Ama Pachana Chikitsa. Once the patient gets relief from that, then you go for that Bhayatisara, Shokatisara Chikitsa. Patient will respond. Yeah.
okay, sir. Thank you, sir.
Thank
Sir, one last question we have. How we can manage the common GIT disorders in a Garbhini?
you.
In a Garbhini,
Uh,
how we can manage common GIT disorders?
no, as I told, the same treatment you can utilize. These drugs are not at all problem for a Garbini.
Okay.
Can be utilized all the drugs. That is not at all problem. Only thing is avoid Sadhyam Hadya Virechana, Shodhana Chikitsa or Shamana Chikitsa can be done. No problem at all. Yeah.
Sir, almost that's the end of the questions that came in the chat box. Now, if any of our participants who wish to speak to sir, you can do now. Anyone who want to ask questions, you can ask the questions right now. You can unmute yourself and ask the question. Sir, in between, can you please tell us how to do a Satyovamana?
Sadyomana. I have told you already.
Yashtimadu Kashaya,
Panta,
Fanta, you have
not Kashaya, Panta.
Fanta.
Give patient 1 or 2 glasses of milk
Okay,
and 1 or 2 glasses of Lavana Jala.
okay,
Okay. Akanta Purti Hopan. Then I give him 3 glasses of Estimadu Panta.
okay.
He will vomit out.
Okay. So no need of any Sadhyo Sneha, means like
No, nothing, no need. Because already dosha uklesha is there. For such patients also only you are doing it.
okay, okay, okay.
Okay. Mamsala, Medura and Prabhuta Shleshma and Ajirni. For these patients and Amabahula, these patients you do it, Satyoman. Not for others.
Okay.
Yeah.
Sir, one patient with hiatus hernia and fullness of stomach, sir. I have given Agni Tundivati Avipattikara, but not responded, sir.
For such patients, don't give Avipatikara. Give him Vaishwanara Churana
Okay, sir.
and Sudshekara. They will respond.
Okay, sir. Thank you, sir.
It's a Vata Pradhana, see. So instead of Avipatikara, give Vaishwanara Churana.
Okay.
They respond very fast. Yeah.
Sir, if a patient complaining of passing of stools soon after taking of food, can we consider this as the IBS and the same is the
I
treatment?
think it is irritable bowel stomach. Irritation occurs.
Okay, okay.
Like that should give.
So
Same line of it. Same line of it.
Sir, management of cholecystitis, gallbladder, already you have told.
I think I have already told. If I say infection is there, go for surgery. Otherwise, pain is there, no, not severe infection in a chronic state. Give Narikela Lavana with the Navasara and Vaishwanara Churana.
Okay,
They will respond.
okay.
Yeah.
Sir, Ardhava Vedaka due to Amla Pitta, sir. In such a cases, what we have to do, sir?
Ardha Vedaka. That
Yes,
is migraine you are saying. Migraine means always it is disease of stomach, not head. So same treatment whatever I told for Ajirana and Amla Pitta, same chikitsa like Suta Shekara, Hingvashtaka and Narikela Lavana, they will respond. All the migraines will respond.
Okay, sir. Thank you.
Sushekara, Hingvashtaka and Narikela Lavana. If needed, if more of Pitta Pradhana, give him Kamadod Mukta and Godanti Basma and Rasnari Churna with milk for application over the head daily. They respond very nicely, most of the cases.
Okay, sir. Thank you, sir. Thank you very
Yeah.
much, sir.
Any other questions? Yes, Dr. Ujjwala.
Hello, sir. Sir, if patient history of gastritis like amla pitta, that the patient had only burning sensation, no other symptoms. That was cured. Then again, the patient comes on only he has a nausea, no other symptoms. What should be the line of treatment? Means only nausea. I gave Madifalarasan. Whenever I give Madifalarasan, that symptoms will relieve. And whenever I stop, then it will
It
increase.
will again. I think Patya should be told and give him Mayura Pichavasma with the Suta Shekhar Rasa. They will respond.
Okay, sir.
Yeah.
And sir, one more I have put the question that like McBurney point, that lump was felt that patient. Then he went for the scan. Then that query was appendicitis. But the patient didn't have any symptoms of appendicitis, only that she felt the mass, and when she go to the scan, that mass was there, that was query, but no symptoms. Then what will be the treatment to prevent? And patient is pitta prakruti. uh, then
No,
can
if
we do Agni Tundi in that? Is it okay?
yeah, if pain is there or if say pus is there, in such condition go for surgery. Otherwise, give Shamanasha, give Gandhakrasana, Kanchana Gugula and Agni Tundi. They will respond. Any Ganatva is there, Kanchanara Guggulu you give.
No symptoms for that patient. Only she felt the lump and she went for scan.
She felt, some lump, that is why I'm telling. If you give Kanchanara Guggulu and Gandhaka Rasayana, it will reduce.
Okay, sir.
Yeah.
Okay, Dr. Rajat, you can unmute and speak. Or Jyoti, you can speak.
Sir, good evening, sir. Sir, my patient is having Yakrut Daliodar. The Shota is reduced and he is also having good appetite now. So, what can be given if he is complaining for the weakness?
Or a weakness.
Yeah, only he is feeling weakness. Mala Murta Pravruti is good and Shota is reduced and he is able to walk also now in a good condition.
I think continue whatever treatment you are giving. They will respond.
But sir, he's every day he's calling me and complaining. What should I do for the weakness? Should I give some gritas?
No, don't give Grita now. Yeah, give him Agni Mandhyahara Chikitsa.
Okay, sir.
I think by
I
then
have,
they will respond.
I have given him Avipatti, first line of the treatment, and I have given Patul Koduranyadi and Yakrut Lihari Yoga, 1 tablet a day,
Yeah.
and Gomudra
I think-
Aritaki at bedtime.
Patola Katuroinya is sufficient. He will respond. That Agni Mandya will reduce after 1.5 months, 2 months. Tell him,
Okay, sir.
just counsel him.
Okay, sir. Thank you, sir.
The
Okay.
treatment is good.
Okay, sir.
Dr. Nagesh, you can speak.
Sir, good evening. Hello.
Good evening.
Sir, kindly suggest me the management of cholecystitis. Myself is suffering from cholecystitis. I am working as a contractual medical officer at a government hospital, sir. During the COVID schedules, due to the hectic work, I got affected with cholecystitis. Already 2 episodes of pain I got. And the gastrosurgeon is suggesting me for the cholecystectomy itself. But
Is there stone? Stone is there or not?
sir, multiple stones are there, sir.
I think better to go for surgery because the stone may go into CBD, may obstruction may occur. For making you silent, stone to silent, take Narikela Lavana.
Narikela Lavana, sir.
Yeah, Narikela Lavana with the Navasara Churna is available. Take 15 grams Narikela Lavana,
Okay, sir.
30 grams Vaishwandra Churna,
Yes,
and
sir.
5 grams Navasara Basma, Navasara Churna.
Navasara Churna.
Okay, mix it. Half of teaspoon take daily twice.
Okay, sir. Okay, sir.
Okay, you will respond. Your pain will come down. Agni Tundi can be taken along with that.
Without any irregular behavioral aspects, I got this much of this one, sir, pain. So because of that, I am worried, sir.
That chance is there because your hectic Vihara itself is sufficient for that.
Yes, sir. Sir, it was
Because you can't take sufficient water. All these things may be reason.
Yes, sir. Yes, sir.
That is because of your service you got it.
Yeah.
Yeah.
Thank you. Thank you very
Anyhow,
much, sir.
all the best. You can take this treatment, you get result. But
Thank you, sir.
anyhow, whenever possible, get operated. Otherwise, there is a chance of complication. That's what I'm saying.
Yes,
You can make it silent by this drug for any number of years.
Yes, sir. Yes, sir. Yes, sir. Thank you, sir. Thank you very much
Yes.
for your kind suggestions.
Yes, Dr. Ujjwala, you can ask.
Sir, that Yashti Madhu Churna Fanta you told, na? So how much should be the proportion for water and Yashti
For
Madhu Churna?
Vamana Karma, Satyavamana,
Yes, sir, yes.
take 100 grams of Yashti Madhu Churna, put about 2 liters of hot water, boiling water. Don't boil it, it's for boiling water. Keep it like that for about half an hour. That is a Fanta. You utilize it. That's all.
Okay, sir. Thank you.
Yes, Dr. Vishaka. Hello.
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 Yes,
Hello.
Vishaka, you can ask.
Good evening, sir. Sir, as we say nowadays, milk we need to avoid for everyone, in fact, because milk quality is reduced so much. But when we use Tikta Kshir Basti for some patients,
Yeah.
then how is it? Like, what
If
will be
you
the effect?
if you take Desi Gai ka milk, that is better for
Sir, it is
Tikta
so
Kshir.
difficult to get such milk in metropolitan cities. That is a big issue here.
Yeah.
And some
Definitely.
patients come to me with genetic analysis.
Yeah.
So that
If you
they say that they are lactose intolerance also.
better to take A2 milk wherever it is available. But
Okay, sir.
otherwise, same milk you have to use. There is no other way.
So my question here is, will Tiktakshir Basti give us that many effects, expected effects, or should we switch on to Madhutailik or Matra Basti?
No, I think Tikta Kshira Sarpi is always better. That Kasha Niruva Basti effect is completely different from Matra Basti. Definitely, it will have its own effect. It's an excellent result is there when you give Tikta Kshira Sarpi Basti.
Okay, sir. Thank you very
Yeah.
much.
There is no alternate to that.
Yes, Dr. Rajat.
Hello, sir. Good evening, sir. A 20-year male patient, sir, he came with just anorexia and he is not having hunger, it seems. When I checked his liver function test, his bilirubin levels were 1.68, sir. And I started with Arogyavardhini Vati and Kamilahara syrup. After 15 days, the symptoms was same, and the levels were increased, sir, 1.68 to 1.92. Whether my treatment is wrong or I should opt for some other. This one I checked is hepatitis B also it's negative, and even I checked his USG abdomen for any calculi or something. That was also not there. No hepatomegaly, no fatty liver, etc. Thank you. Please suggest.
No, in whatever you said in such conditions, you give you have given the Aragyavardhini instead of Aragyavardhini, it makes more Ushna. So Patola Katurhoinyadi Kashaya or Patola the Kashaya is better drug in such conditions. Or
Okay.
Palasrika Kashaya is better.
Okay, sir.
So Aragyavardhini has Tikshna Pitta Rechaka Dravya, Katugarohini is there. Instead of that, you can use Patola the Kashaya or Palasrika Kashaya. Or Triphala itself, these drugs are better, I think so. Because when Ushnata increases, there will be Rukshata. Due to Rukshata, patient may have more of anorexia. In such conditions, better to switch to some other drugs which have less Rukshata, dravyas. You can use Amalaki Churna or Triphala Churna also such conditions. Patient will better respond for such cases.
Yes. Thank you, sir.
Okay.
Jyoti, Dr. Jyoti, you can ask.
Sir, as you told for cholecystitis, we should give Navasar Churna. Is it Navasagar or any other Churna?
Navasagar. Navasagar.
Okay, plain Navasagar. Okay,
Yes,
sir.
yes.
Thank you, sir.
Sir, one last question has come from Dr. Ujjwala. What is the treatment for lactose intolerance?
Lactose intolerance. No, we should not think in that way. Just you give Ajirnahara Chikitsa. Specifically, Musta Kashaya is the drug of choice. Musta. Musta Kshira Kashaya you give. Such patients will respond very nicely. Small babies also come with the lactose intolerance. Such Musta Kshira Kashaya if you give, a patient will respond very nicely. Can be utilized. Their intolerance will go.
Okay, sir.
That is.
So we have come to the end of this session, sir. Almost. Yes, doctor. If you want.
One more question, ma'am. Sir, is it possible to treat cholelithiasis completely, sir? Complete disappearance through Ayurveda?
In cholelithiasis, which cholelithiasis?
Yes, sir. Yes, sir.
No, it cannot be cured by medicine.
Okay, okay, sir. Renal
If it
stone,
is,
sir?
if it is a multiple stone, not possible. If it is single stone, I think you can give same drug for long term. They may respond. It will reduce in size. A multiple stone, not possible. Single stone, I think it will reduce with the treatment. You give Arogyavardhini on these drugs, they will respond.
Okay, sir.
Yeah.
Hello, sir. One
Thank you.
single question regarding lactose intolerance again. Many patients come with the genetic analysis. Till the age of 20, 25, they had a milk, but all of a sudden they go and do their genetic analysis and they come to us with a report that they are lactose intolerant. So, in this condition, what should be done? Should we ask them to avoid milk completely, or should we give Mustaq, Sher Kashai as you just suggested?
I treat such cases with the Mustaq Shira Kashaya. They respond very nicely. Mustaq Shira Kashaya.
Okay, sir.
But,
Thank you.
if still they have the intolerance, better to avoid the drug. Avoid the milk.
Okay, sir. Thank you very much.
Instead of that, they can take buttermilk. That is a takra they can use.
Yes, sir.
Yes.
So, sir, one more question. How long Mustakshira Kashaya had to be taken for this?
Mustaq Shira Kashaya.
Yes.
It should be taken about 1.5 months, 35 days.
Okay. So, sir, we have come to the end of questions in the chat box, and I hope we don't have any of the participants who still wish to ask question. Please make it fast, or else we'll wind up the session here. Sir, I hope we don't have any other further questions. So I think we'll wind up the session here, sir. Once again, let me thank you for your wonderful presentation as well as patient listening to the questions and answering it in a very easy and a very understandable manner, sir. Thank you so much once again. Thank you for being a part of Ayurveda Map also. Thank you, sir.
Thank you. Thank you.
Thank you, sir. Thank you very much. And I hope we can see 1 week later on anorectal diseases.
Yeah. Yes.
We are waiting for that.
Okay. Okay. Thank you.
Okay. Thank you, sir.
Now I have a request to our participants. Please give away your feedbacks about today's session. We would love to hear from you. Dr. Ujjwala.
Hello, sir. It was a very wonderful session, and actually, it helps us to think right way. And when you tell us, then what treatment we give to patient, when we feel it is correct, then we'll get more energy and we'll get more means each patient is different and each patient is different, and for each patient we have to give different treatment. It's not like one protocol we have to follow. Thank you so much, sir.
Thank you, Ujjwala.
Sir, thank you so much, sir. It was really a wonderful session, sir. So in day-to-day practice, we used to get all these cases regularly, and even especially in Amla Pitta cases, we used to struggle many times to select perfect medicines. But today's session was really good. We cleared a lot of doubts, sir. Thank you very much, sir.
Thank you. Thank you, Dr. Vishwanath. Yes,
Sir?
Dr.
Sir,
Yes, Dr.
thank you. Sir, Dr. Nagesh speaking. Thank you very much for the wonderful session, sir. Really a practical oriented, result oriented concepts you have told. Sadhyo Shamana, Sadhyo Virechana, Shodhana techniques you have all told. It is very useful for us in our future practices. I am also from Karnataka, sir. Hope I will come and meet you personally once to Puttur. I will come and meet you, sir. Thank you very much for the wonderful session, sir. Good day to you, sir. Good night.
Thank you, Nagesh.
Can we have your contact number, sir?
Okay, that we can provide. Okay. Okay.
Thank you, sir.
Yes, Dr. Jyoti.
Yes, ma'am. Good evening, ma'am. Good evening, sir. It was a very wonderful and a very informative session, especially the Falashruti, that some churnas are used in the upper part of the intestines, and some are used in the lower part, some are used in the upper part, just like umbilicus, and some are used in stomach part. It was very, very elaborative session. Thank you, sir.
Thank you. Thank you, Jyoti. Yes, Dr. Vishakha.
Thank you so much, sir. That was wonderful session, sir. And we will thank Ayurveda Map also for arranging a great personality in Ayurveda for these sessions, and really practical oriented sessions. These things going on. We are struggling really for treating patients with Ayurvedic medicines, but when we hear the words of Ravi Shankar sir, we are more confident in treating Ayurveda with Ayurvedic medicines to my patients. Thank you so much, sir. Thank you.
Thank you. Thank you, Dr. Rajat.
Hello.
Yes, Dr. Pooja.
Yes. Hello, sir. It was a very wonderful session, sir. As for a new practitioner, like I am a new practitioner now, so it is very inspiration for us, sir. So even I cleared so many doubts which I already have, sir. Uh, I'm very thankful to you, sir, because now I can. I'm very confident now, so I can like more concentrate on the patients and really thank you so much, sir.
Thank you. Thank you, Dr. Pooja. So I hope we'll wind up the session. Thank you, everyone, for your feedbacks. And see you in the next session tomorrow. Stay safe and good night.
Thank you.